Hello to everyone, whoever is watching, and this is Dr. Rampapa, and we are from PACCS Healthcare Organization and are in the business of putting up, or rather promoting transitional care of late recently, and we thought that is the need of the country, getting into subacute care space, with a lot of emphasis on physiotherapy and recovery after a major illness from any of the emergencies or disease conditions. So we were fortunate to come across the Statoon Labs, and they were in the process of building up something which has an objective assessment or measurement of certain of the movement disorders and in relation to movement disorders, and for measuring the range of activities across joints, and then probably also measure the electrical conduct in the skeletal muscles. We actually were fortunate to associate with them in conducting some of the clinical trials for this device in our own units at Ucchvas. And there were two clinical trials that were published in collaboration with them, and which actually took place at Ucchvas. And I'm happy that this device has come out so well with a great level of precision. As you all know that today, after an acute care management, the patients expect rapid results. But then unfortunately, any of these neurological conditions or any of the musculoskeletal disorders, for them to recover after an acute management, it takes quite a long time. That's why this device would actually help them in monitoring the recovery in these two major clinical conditions. Apart from that, I think in geriatric population or for any of the conditions that involves some autoimmune disorders like myositis or any of these musculoskeletal problems, I think it's a great tool to measure the activities there, and then give an objective assessment of it the same to the patient to keep up his morale about his improvement. And then over a period of time, I think it becomes very easy to convince these people, because however much that you may try to convince them, these are all long-term care therapy regimes, and however much you try to convince them, sometimes you hit a roadblock, and then it's very difficult to pep up the morale of the patients. So at that time, it will be a great tool even psychologically to show them the recovery path. And then, it's a great tool to use. And then we are using ourselves in both our units in Hyderabad at Ucchvas. And then we find it very, very, very useful. And actually, I congratulate the Statoon Labs for actually bringing out this type of device, and hope that the usage will increase exponentially. And it's a great tool to use.